Thank you very much. Thank you for having me. I want to start off with a statement to you that men should not be nurses and I should not be a nurse. And you've heard that right. This is probably going to be problematic for me because given that I teach nursing and I am a nurse, I may well be out of a job. But if you wouldn't mind bearing with me, I'll tell you why. I actually think it's quite relevant and timely to talk about today about this because it is actually International Year of the Nurse and Midwife. And you only need to turn on the news, and we've heard a couple of times here today, to see healthcare workers at the fore of much of the discussion. The tired faces, the marks left from masks, and them feeling exhausted. And why am I making this point? And I think it's typical that nursing, and particularly men in nursing, have not been portrayed in a particularly positive light. And I suppose if I was to ask people here today to think about what a nurse is to them, I could probably hazard a guess as to what some of you are thinking. And I wanted to point out this is a far cry from what nursing really is. Now, many of you will be familiar with the TED Talks, and as I say this, I'm pretty sure, again, many of you here in the room will be thinking about your favourites. Sarah Knight, Tim Urban, Brené Brown are three that I particularly love. And the basic premise of the TED platform is ideas worth spreading, and I genuinely felt that I had one worth spreading. Now, locally driven TED events are called TEDx Talks, and the one locally is TEDx Brayford Pool. And this platform is not the poor relative of the TED family. They carry a lot of weight and are required to follow exactly the same rules as TED Talks. This became very apparent to me as I moved through the process. So last year in 2019, I applied to the 2019 TEDx Brayford Pool Talks, and out of 90 applicants, I auditioned, X Factor style, or sort of, for one of 11 spaces that would present at the annual event. I was lucky to have been chosen because the competition for that was very, very good. I then spent the next 4 months being coached in public speaking and getting my idea worth spreading in under 18 minutes. And those of you that are in the room that probably know me can realise I probably find that very difficult because I do love to talk. Now, I assumed that I would be able to do this because I'm a lecturer, like many people in the room, and standing in front of people is absolutely fine. But I soon realised I was no public speaker. And I realised very soon that I had the platform, which would have the potential to have a worldwide viewing. And I wanted to then discuss what my idea that I had that was worth spreading. Now, I'm a rare breed as a nurse, and I wanted to give the audience at TED and here 4 reasons why I should not be a nurse. Now, number 1 is the statistics. Nationally and pretty much globally, apart from a couple of exceptions, men in nursing account for 10% of the workforce. So when you look at that statistically, men should not be nurses because 90% of the workforce are in fact women. My second reason as to why men should not be nurses are society's perceptions of what nursing is. Now, I'm pretty sure that many of you remember last year's London Marathon 2019, when a particular nurse ran the London Marathon in the fastest time wearing a nurse's uniform. And it got contested by the Guinness Book of World Records because she wasn't wearing what they perceived to be a nurse's uniform, which was a short skirt, stockings, suspenders, and caps. And nursing has not worn caps in 30 odd years, and I can tell you there's nothing sexy about nursing. Added to that, I had the opportunity where I was quite proud of myself. I managed to acquire an exhibit from the Lincoln collection, which was a backpack that had a picture of a female nurse on it with a cap. And I just felt that I was doing my little bit to remove this imagery away from the public. The third reason why I think men should not be nurses is from the media. And I've already mentioned that you've probably got your own perceptions of what nursing is from that. But one that struck me was very, very recent, within the last 5 to 7 years. And that's from the hit series Glee. And I never watched it, but I certainly became aware of a particular scenario where 2 women are talking, and one says she wants to be a female football coach or a football coach. And the other one says to her that being a female football coach is like men in nursing. Both are a sin against nature. So there you have it at the moment. First three, I am a rare breed because I'm in the 10%. Society would perceive me as needing to wear a short skirt, suspenders and a cap. And the other one is that I am a sin against nature. My fourth point about why I felt that men should not be nurses is from my very own profession. Within my profession, I can't think of any other profession that exists that uses gender-specific pronouns to describe its workforce. Yet in nursing, we still use the words sister and matron. Second part of my talk was about flipping perceptions. And I wanted to then bring that forward to say that actually the reason why it's International Year of the Nurse is because it celebrates the 200th anniversary of Florence Nightingale's birth. And I wanted to flip perceptions to sort of say that Florence Nightingale was not just the lady with the lamp, but she was also the first female member of the Royal Society of Statisticians and is largely credited for her work around the polar area diagram, where she demonstrated the death rates in the Crimea. Now, of course, my first statement that I started about men not being nurses and I should not be a nurse is clearly not true. And given that the nursing vacancy in the UK currently stands at about 40,000, our society needs more people to be nurses than not. So my idea worth spreading was to challenge people to change their perceptions of what nursing, and particularly men in nursing, is. And I feel personally that young minds are probably influenced quite a bit by that. To clarify, TEDx Bradford Pool is independent of the university, as are TED Talks generally, but it was clear that I was a nursing lecturer from Lincoln, and it gave me a platform to deliver a talk on a subject that I am passionate about and that needs to be addressed. TEDx gave me that opportunity to spread my idea, and to date it has had over 4,000 views globally. So thank you for inviting me to do this, to talk to you, and in fact I am very, very proud to be a nurse and a lecturer here at Lincoln. Thank you.